Penicillin G and V, simplified summary. Mechanism of action. Penicillin G is given by 4 or IM. Penicillin V is taken by mouth. They are beta-lactam antibiotics. They mimic a part of the bacterial cell wall building block. They bind to penicillin-binding proteins, which are enzymes that build the bacterial wall. This blocks the final step in making the wall and causes the bacteria to break down. Clinical use. Best for gram-positive bacteria like Streptococcus pneumoniae, Streptococcus pyogenes, and Actinomyces. Also works on some gram-negative cocci like Neisseria meningitidis. Effective against spirochetes, especially Treponema pallidum, syphilis. Kills a range of bacteria but is sensitive to destruction by beta-lactamus. Side effects. Allergic reactions. Hemolytic anemia due to immune reaction. Kidney problems like interstitial nephritis. Resistance. Caused by bacteria producing beta-lactamus, which destroys the drug. Can also be due to mutations in the penicillin-binding proteins. Question 1, Mechanism and clinical use. A 23-year-old man is diagnosed with primary syphilis after testing positive for Treponema pallidum. Which of the following antibiotics is the most appropriate treatment? A. Azithromycin. B. Ceftriaxone. C. Metronidazole. D. Penicillin G. E. Vancomycin. Correct answer, D. Penicillin G. Explanation. A. Azithromycin, sometimes used for chlamydia or in macrolide-sensitive organisms, but not first line for syphilis. B. Ceftriaxone, used for gonorrhea or severe disseminated syphilis if penicillin is contraindicated, but penicillin G is first line. C. Metronidazole, used for anaerobes and protozoa, example Giardia, trichomonas, not syphilis. D. Penicillin G, correct. It is the drug of choice for all stages of syphilis, especially effective in early stages. E. Vancomycin, reserved for resistant gram-positive organisms, like MRSA, not useful against spirochetes. Question 2, Resistance and adverse effects. A 10-year-old boy with a sore throat is treated with oral penicillin V. He returns with signs of dark urine, fatigue, and positive Coombs test. Which of the following best describes the most likely cause of these findings? A. Renal tubular necrosis. B. Direct toxic effect on red blood cells. C. Type I hypersensitivity reaction. D. Autoimmune hemolytic anemia. E. Red cell destruction by bacteria. Correct answer, D. Autoimmune hemolytic anemia. Explanation. A. Renal tubular necrosis, not typically associated with penicillin use. B. Direct toxic effect on red blood cells, penicillin causes immune-mediated destruction, not direct toxicity. C. Type I hypersensitivity reaction, causes rash, anaphylaxis, but not hemolytic anemia. D. Autoimmune hemolytic anemia, correct. Penicillin can trigger a direct Coombs-positive hemolytic anemia. E. Red cell destruction by bacteria, unrelated. Bacteria do not typically destroy red cells this way.